So you must have been taught basic anatomy, physiology, right? So as all these yogangas, they affect our body, means physical, physiological, psychological, and spiritual. And our aim is to go to spirituality. That is the ultimate aim. So, as we are born means we are going to die, right? So, we are inflicted with many problems throughout our life, either physical level or psychological level. We are given certain physical structure. Everybody has got different physical structure. Everybody. No, even twins are not identical. Nobody is identical. If we know the person from the back, also we can identify that person. From the voice also we can identify the person. So there are so many parameters so that that person can be identified, because it has got many things to be unique. And that uniquity is his personality. But if something goes wrong, either on physical level, physiological level, psychological level, then we come to know immediately that something is going wrong. And as you are going to be yoga therapist, you must know what are to be examined in that patient. We must ask the history. That history is very important. What are his or her sufferings? So something, his physical or physiological or psychological problems, some shift from the normality is there. Some shift from the normality is there, and something is abnormal. And what is the abnormal? That we have to find it out. That we have to find out. And for that, we have to take history. We have to take the history of the patient. So you must be knowing what are the things we have to look into the history, right from name, place, age, height, weight, color, his gait, posture, his eyes. These are the things we have to judge. And some things we have to ask the questions also. I will have you given how to make the case paper sheet, history sheet? History sheet, are you taught? Give me some response from
No, ma'am. No,
no, madam. No, madam. No.
Okay,
please,
I will give you the history sheet also. What are the things we have to include in the
एक मिनट मैडम, सभी लोगों ने रिस्पांस देना है. जूली, पूनम, अर्चना जी, रितु जी.
If you open up, then I will come to know your response. If you have understood, not understood, whether I have to explain again, no, it doesn't matter for me. So accordingly, we must know the normal physique of the fully grown person. We are going to talk here about the fully grown person. So what should be the normal height, normal range? normal weight. Then so many other parameters are also there. Try to remove your parda, curtain, so that I don't know. I'm just looking at
Yes.
Vijayji and Kantilalji.
We feel we are
So
teaching
I will come to
only
know.
to wall
Only
only.
few people are there. So anyway, so I can, looking at your face, I can have some judgment about you, whether you understood or no. So we are going to see what are the normal parameters and what is the abnormality in that. So that thing is called, that science is called anthropology. Anthropology. There are certain parameters, they are in the normal range for everybody. If there is shift, either positive side or negative side, that also how we can judge them. Certain range is there for normal measurements, or standard levels are also there in range. So external and internal, both external morphology and internal morphology, that is structure. So that called the anthropology, and these measurements are called anthropometry. So that we are going to now see. I'm sharing what is the anthropology, what is the anthropometry, that we are going to see now. Can you see the screen? Can you see the
Yes,
screen?
yes, ma'am.
Yes, yes, yes.
Okay. So here the definition of anthropometry is given. It is the branch of anthropology that involves the quantitative measurements of the human body. Quantitative, it is the quantitative measurement of the human body. And all these measurements, they are standardized with the range. Not that everybody will have the height of 5.6 inch or no, there is a wide range is there, weight wise, height wise, and other things. Even bone stature is also different for different person. Some people have got broad bony structure or double bone, that is called double हाडाचा एखादा म्हणतो आपण तसं. So let us see what we have to consider in it. They are all universally applicable, and just simply with few gadgets only or instruments we can measure. Just simple instruments are there which are using in day-to-day life also. It is non-invasive technique. So size, proportion, composition of human body, that we are going to measure. Then with that, if there is a shift, then we can have some interpretation from that conclusion. So from infancy to old age, the measurements keep on changing. And these are very tools to measure the health, status of the health, nutritional status, what it is, his or her psychological status, all these can be measured. Even it is very important as far as growing children are concerned. They are very important. Right from infancy or neonates, it is very important that how the baby is growing. Whether the baby is getting proper food, nutrition from the mother, breast milk, then top feeds, how they are going, that That is there are some parameters which can indicate the growth of the child, and it is mainly important for the in pediatric branch, means for the children. And now here anthropometric measures which are commonly seen or taken care are weight of the person. Now here we are going to think of adult person, fully grown person. Weight, height, waist circumference, hip circumference. These are very important from our point of view. And other two are BMI, body mass index. Body mass index means your height, weight ratio. Height and weight ratio. And waist to hip ratio. These are the certain parameters that we are going to see. The basic measurements are height from the sole of the feet or from the heel to the top of the head. That I will show you the pictures, how to make the person to stand, how to measure the height. Then height, mass, BMI, then triceps, then fat measurements. Fat measurements, at what level we have to take the fat. Fat index is also indicates how much fat collection is there, whether it is good or not. At certain level they are taken, that is tricep skin fold. Tricep muscle, all of you know, where is it? Tricep?
In the upper arms.
Arm,
In the
back,
upper arms.
arm. This is the front of the arm. Now this the directions of the body. What is the front portion? What is the back portion? What is the proximal portion? What is the anterior? What is posterior? What is the medial? What is the lateral? In relation to body, we must know all these terminologies. So tricep is the back of the arm. This is the back. This is the front. And this is back. So tricep skin fold, we have to measure how much thickness is there. And everybody has got a different type of different pattern of fat deposition. Somebody have more fat in the hand, somebody has more in the thigh, somebody have in the buttocks, somebody have in the abdomen. So accordingly, the fat distribution differs from person to person. So we are here now, we'll take into consideration waist, hip, mid-arm circumference, and these are and their ratios. Now, height measurement technique. How to take the height? How to measure the height? So here I will show you the picture. Instead of going into the description, written this thing, we'll go into the picture directly. Now the person, how the person is standing. Here is a platform, lower platform, maybe over ground or some platform may be there. Then person is standing with the heels touching this vertical board. And the both the feet are at the angle of 60 degrees. Then your calf region is touching this vertical board. Then your hips are touching the board. Then here scapular region. Scapula, you know where it is?
At the back.
Back. Upper back. that is shoulder blade that we call in general routine. So here is the scapula and here the back of the head. These 5 points are touching the vertical board. It may be the wall also. The measurements are drawn on the wall also. So this should be the position of the person. And then upper board, that horizontal board is touching the hairs, means press little bit, because some may be having a mass of good mass or gorgeous hair, or some may be having just bald, some may be bald, no hairs. So just little light pressure should be there, and then you measure the height. Here it is shown. Then you can put the that rule, measuring rule. So it will it should be parallel to the ground and touch the back. That is, here wall is there. So this should be the correct method of measuring the height. You got it? Any question?
No, ma'am.
Okay. Then BMI. BMI index is essential to measure the obesity. And this is expressed as a ratio between your weight in kilograms divided by height in meters, height square in meters. So measure your height in meters. Suppose you are 5 feet 4 inch. So what will be the centimeters? What would be the centimeters? How many centimeters or meters? 5 feet.
5 feet 2 inches is 157 centimeters, and you add 2 centimeters to each inch.
It comes to 1.6 meters. It comes
159.
to
159 centimeters.
Yeah. For the just now for the calculation, we will think that your height is 160 centimeters or 1.6 meters. 1.6 meters. Now you have to make the square of 1.6. So how much it will come? What is the
2.56.
2.56.
Yeah, correctly it is 2.56. So, and your weight is suppose 64. Your weight is 64. So how much will be the answer? It will come to, can you calculate? You can
2816.
calculate on also. No, don't give much of strain to your brain. So it comes to
25.
25.
Around 25.
So your body mass index is 25. Okay. So now we'll see what is the normal range, what is the underweight, or what is the obese, minimum obese, maximum obese, dangerously obese. Because that obesity or weight also has got very much importance in our life. So let us see. Now here the BMI index is given, their classification is given, and what is the clinical importance of this BMI index, BMI, body mass index. So, and what are the risk factors in it? Now, normal range is between 18.5 to 24.9. 18 to, we can take 18 to 25 is the normal range. Is the normal range. Person is neither very thin nor very fat or bulky or obese. So here the risk is negligible. So it is a normal range and it is a quite big range. So 18 to 25. If it is more than 25 to 30, we will take. Between 25 to 30, it is overweight. It is overweight. And the risk factors, a little risk factor is there. So one should try to reduce the weight. Now, if it is more than 30, if it is more than 30, then it is called obese. You are turning towards the obese, shifting from the normal weight. If it is 30 to 35 or 34.9, then it is again now further it is divided class 1, class 2 and class 3 obesity. So this is 30 to 35 is moderate obesity, 35 to 40 is the severe obesity, and more than 40 it is very severe. Now can you tell me what are the problems occurring with the obesity? Do you know what are the problems with the obesity? The
BP,
patient comes to
hypertension.
you and he or she is overweight. So what the problems he or she
all in
will
one,
narrate to you?
all in one.
He wants to
Diabetes,
come out.
high BP,
Diabetes, thyroid,
thyroid,
all BP.
Yes, thyroid, okay.
high
BP,
BP,
BP is
diabetes,
diabetes, right?
knee joint, knee pain,
Joint pains, overall joint pains.
then breathing pattern,
Breathing pattern, okay.
there are tension, hypertension,
Hypertension, okay, somebody told BP. So almost the obesity affects your whole of the body in some or the other way. You have most of the things you have told me. So this obesity is also the indication of many underlying diseases also. Like somebody told that thyroid, hypothyroidism is that also gives rise to obesity. Then joint pains, heart is also affected. Then moving is difficult for these people, or all the motions are not possible for them. It is not easy for them to walk fast, to sit, to get up. So movements also they get affected with obesity. So by looking at the BMI index, you have to plan the yoga therapy for them and what are the other organs affected due to obesity. There are many problems, and not only that, not only it is the overeating, the underlying other problems also we have to look into. So eating, then even psychological problems like depression also cause obesity. So that also you have to take into consideration. That's why BMI index is very important. Some people they have got the weight as much as 500 pounds, 600 pounds, and so on, and so on. So we have to look into their eating habits, any addictions they have, their lifestyle, everything we have to take into consideration. Then waist to hip circumference ratio. Here, waist and hip means a type of fat deposition. A type of fat deposition. So this is waist to hip circumference. How much should be the ratio? That we will see. Now, waist circumference should be measured at the level of anterior superior iliac spine. Do you know what is the position of anterior superior iliac spine? Do you know? Anybody know where it is located? Anterior superior iliac spine? Can anybody tell?
Is the anterior is the front side. And
It is
superior
front
the-
side
and
Waist.
upper side.
and
Upper side. Upper
See,
side.
it is
Superior means
the-
upper side.
it is the projection of the bone of the iliac bone. So if you trace your waist and go down, and there at the sides, you will feel the bony projection through the abdominal wall, side laterally or to the sides. You will feel the projection of the iliac bone, and it is called anterior. Hey. Yes, sorry. So anterior superior iliac spine is the projection of the iliac crest, where we put our hands on the waist and you keep on tracing little bit down there below the umbilicus. It comes below the level of umbilicus. So that is, no, it is not there, sir. Kantilalji, it is not there. No, not here. Not on the chest.
Waist.
Here it is down. Dr. Jain, he is showing you. Now his belt is there. A little bit. His belt. So you examine yourself. Where is that? Then only you will come to know where to take the measurement. Where to take, I will show you the picture then. Okay. So it is below the level of umbilicus. And if you keep on tracing this iliac crest, where we put the hand on the waist here. But you have to trace down and here there you will feel the bony projection here. Here I am keeping my fingers here. Here. These are the spiny projection of the iliac bone, and at that level you have to measure the circumference of the abdomen there. That is the waist circumference. And hip measurement is to be done at the maximum projection of the hip, maximum point of the hip, not below, not up. So maximum projection of the hip, from that point you have to take the circumference. So waist to hip. So what importance it has got? So it can be a marker or the guideline for the coronary heart disease. More the fat in the abdominal region, more the risk of coronary heart disease. CHD here, that is coronary heart disease. The men have more higher ratio than the women. In the women, it is 0.85 to 1.7. So more the ratio, higher the risk. So it should be around 8.85. It should not go more than 1. If it is below 0.85, then there is low risk of coronary heart disease. And in men, it should be 0.95, less than 1 to 1.9. 1.9 is very high risk. So abdominal fat should be less. And we, in Indians, abdominal fat is maximum in the pelvic region, in the lower region. As our age increases, the lower abdomen comes out, even in ladies also. And I think this is in Indian people, it is the, what we say, it is a racial thing. Especially Southeast Asia and Indian people, they have got maximum fat in pelvic region. And after delivery, it is there, like again they are pregnant, 5, 6, 7 months and never delivered. So this is the importance of hip to waist. And so with the different types of yogasana, Surya Namaskar and Sushma Vyayam, whatever it is, it can be reduced. So accordingly, you have to plan. Now, measures of body composition. So we have to think patient mostly complain that their weight is not increasing, or their weight has increased, or their weight has reduced a lot in last few months or so. And the fat distribution also changes. So we have to inquire into their other problems also. What can be the cause of loss of weight? So there are many causes are there for the loss of weight, right from diabetes and other problems also. So we have to inquire into the underlying problem. So and we have to diagnose accordingly. Then again another parameter of the distribution of the fat, that you measure the skin fold of the mid arm. Mid arm, I told you, the back of the. So it is a tricep region. The tricep muscle is from shoulder to here up to the olecranon process. This bony process is there. And so at the midpoint of the arm, that vernier caliper is there. Some instrument is there. So that you can measure the skin fold fat, skin fold, and mid arm muscle. So that is more correct method of the composition of the body, or the composition, changing composition. So here at the mid arm, that you have to measure, you have to pick up the fold of the skin, and it should be such that underlying there will be the muscle you will feel. You can feel yourself also. Feel the muscle. You must feel the muscle. That much fold has to be there. All of you try. Yes, but right. Underlying muscle you should touch, and that should be the fold. Approximately half of the total amount of fat tissue in the human body is located below the surface of the skin. Below the skin, there is subcutaneous fat is there. This makes it possible to predict total body fat from the skin fold thickness with the relative high degree of accuracy using the simple two compartmental method. Then this accuracy is confirmed by CT scan also. CT scan, all of you know that what is the thickness of the fat in that region. Subcutaneous fat. So how to measure it? Just now I told you, you can use your finger and keep it in the clamp of vernier caliper is there. Yes. Hold the position for 3-4 seconds. Take the 3 measurements for the accuracy. Provides the actual skin fold thickness in mm. Tricep skin fold. So it closely concerned with the percentage of the fat and with the total body fat. It varies between 6 to 12 mm in lean individuals and 40 to 50 mm in obese individuals. Many times that fat is so much that it starts like hanging. If the hands are, it may be as big as this much, 5 centimeter fat, and it hangs down. It hangs down. If muscle has no tone, then it will hang. It will hang down. So this is in the obese individual. When we will call the individual to be obese, if this skin fold is thick from 40 to 50 mm. Other skin fold measures are biceps. Bicep is here anteriorly. Yeah, here it is. So you pick up the skin, and so that it should be above the muscle tissue you will see, and there you have to keep the caliper. Then subscapular skin fold at the back. Subscapular means below the scapula. Then suprailiac skin fold. This is the ilium bone. Above that you have to measure the fat. There is line of fat is there. Those who are very fatty and they have got like a tire-like fat is there. So suprailiac skin fold is there. Now this is anthropometry in children. They are very important only to judge their growth. So height, and this is the weight. Child should be, all the clothes of the child should be removed and he should be kept on the machine like this. Okay. Then height. So this is the head point or headboard. The head is touching. This part of the head, crown of the head is touched here, and his leg is, one leg we will do, touching the lower board, and that will indicate the measuring things are here. So it can be measured, height of the children. Then here is the circumference of the head, occipital, frontal, circumference. Occipit means back portion of the head, frontal means front part of the head, and that indicates the growth of his brain also, skull also, and whether he is increasing in height, weight according to their age. That should be calculated. That is not important for us. Again, same thing, height, length, weight in children also. Demispan or arm span, just now we have seen. Knee height, height from the knee down. Sitting height, after sitting the height is measured. Skin fold thickness and head circumference. I will give you one link there. You can see the how to measure and all these things. That already we have seen. Now, this anthropometry is also important from athletes' point of view. Athletes to measure their strength, fat distribution, activity, and their flexibility. So all these things are important for the athletes. This has been shown to optimize the competitive performance of athletes and to help identify underlying medical problem if it is there, such as eating disorder. Overeating is also a disorder. It is a disease. It is not that person likes to eat all the time, but many times some psychological problem can be there, then some hormonal problem like hyperthyroidism. They keep on eating and eating and eating, but they are not putting on the weight also. So overeating is also itself a disorder. Body mass index we have seen again repeated. 6 types of obesities are there. Why they are? The food obesity is there, overeating and frequent eating. Then thickness due to nervous stomach. Keeps on getting hungry and hungry all the time. Then gluten diet. Gluten diet means gluten is a protein present in the wheat. Some people are not able to digest the gluten. It is called gluten sensitivity. So high gluten diet means मैदा वगैरे आपण म्हणतो ना, त्याचे पदार्थ सुद्धा आपल्या शरीरासाठी घातक असतात आणि they increase our weight. Genetic metabolic obesity. It can be genetical obesity also can be there. People in the home, they all are fat. Their parents are fat. Then their progeny is also obese. So it can be a genetical also. Then venous circulation obesity is there. If venous circulation is not proper, then there is a edema type of fat distribution is there. It is a like edema. Common health consequences of overweight and obesity. Bradypnea is a major risk factor for non-communicable disease such as cardiovascular diseases, diabetes, musculoskeletal disorders, means all joints are affected, osteoarthritis, highly disabling the degenerative disease of the joints that we have already seen. Some cancers including endometrial, breast cancer, ovarian cancer, prostatic cancer, liver, gallbladder, kidneys, and colon, they are also present in the obese patient. Not only cardiovascular, but all these degenerative diseases, cancer-like diseases, they are liable to get. So how this overweight and obesity can be reduced? So we have to first treat the underlying diseases. Overweight and obesity as well as their related non-communicable diseases are largely preventable. These diseases can be preventable provided there is no hormonal problem and other problems. So people can limit the energy intake from the total fat and sugars. Sugar, fats, glycemic diet should be avoided. They should take more of proteins. Fats and sugar, that be like fried food, then all these sweets from the sweet store, they should be avoided. We don't know what is the type of fat has been used. Increase consumption, increase the consumption of fruits and vegetables. Take more of vegetables, fresh fruits as well as legumes. Means all the आपण कडधान्य म्हणतो ती legumes, whole grains. Don't eat maida and all these things, fine refined food. Whole grain, that bran should not be removed. nuts you can have all the types of groundnut, coconut, then almonds and other dry fruits that can be used. Engage in regular physical activity 60 minutes a day for children and 150 minutes spread through the week for the adults. That is minimum it is required. As your age increases, activity need to be increased. Individual responsibility can only have its full effect where people have access to healthy side. That introspection is needed. Why you are? Do you want to be fat and do you want to entertain your tongue only? That you have to think first. Those who are having overeating habits are there. So that you have to think whether that desire must come from you from inside, from your mind itself. Then only it is possible. So if somebody is saying it is not possible, so it must come from you. How much weight? You have to be aware of yourself. Look in the mirror. How you look? Is it a good look or no? So you judge yourself. That is the first statement. Okay, how much the person feels about his weight and all these things, about his disease. Or otherwise take the tablet. I am taking the tablets. Keep on taking the tablets. Okay. Now there are certain instruments which you need to know and you must be able to handle them. So here the blood pressure measuring instruments are there. Now this is the most old one, but still it is most reliable. This is called mercury sphygmomanometer. Here is the column of mercury is there in the center. Okay, and here that one vesicle is there. Cup is there where there is a mercury is filled in it. And here is the pump. And here is the cuff. Here. You put the cuff here. And then this is the pump. Pump the air into this bag. And that will resist. And that resistance will be, will give pressure to move the mercury up on this. And this will indicate your blood pressure. Now there are two types of blood pressures. Systolic and diastolic. All you know systolic and diastolic pressure?
Yes, ma'am.
Do you know all of you? Systolic
Yes,
and
ma'am.
diastolic pressure? Okay, very good. Systolic pressure, it is the indication of the contraction of the heart. Systole means the contraction of the heart, and diastole, it is the relaxation of the heart. Still, some pressure is there in the vessels. And it is measured, the blood pressure is measured at the this elbow joint. Here is the brachial artery is there. It comes from the medial side here, and here you may feel, or you have to keep the stethoscope on it. See, here it is seen. This is the arm. Here at the elbow joint, the chest piece of the stethoscope is seen. You must be able to see the take the blood pressure. When now you push the air into the instrument until you don't listen to the heartbeat, and then you reduce the pressure slowly. As soon as you hear the pulse, that point is of systolic blood pressure.
मैडम मैं दिखा रहा हूँ यहाँ पे
हे नहीं है, हे स्पायरोमीटर है.
हाँ स्पायरोमीटर
स्पायरोमीटर
स्पायरोमीटर एंड स्टेथोस्कोप.
हाँ स्टेथोस्कोप.
इनको मालूम नहीं रहता है ना, तो दिखाना पड़ता है.
नहीं तो इसलिए तो मैंने ये किया ना, इधर इंस्ट्रूमेंट सब लाके रखा है इधर.
यस यस.
हाँ That instrument is there afterwards, after this slide. There are different types of blood pressure taking instruments are there. विजयजी 1-2 मिनिटं थांबा ना, मी दाखवते.
हो हो
मग मी तुम्हाला दाखवायला सांगते. ही 3-4 प्रकारचे इन्स्ट्रुमेंट्स आपल्याला मिळतात. ऑटोमॅटिकही आहेत. नुसतं बटन दाबलं की हवा भरली जाते आणि हे केलं ते तसं मॉनिटर करतं.
येस येस
खाली यायला लागलं की ते इन्स्ट्रुमेंट हे
येस येस
इलेक्ट्रॉनिक डिजिटल.
येस येस
This is electronic. This is again manual.
Sorry, I may disturb.
So we have to know,
Systolic and
important
diastolic.
thing is that here is the bag, and that bag must come on the medial side, in inner side of the arm, in this span, here to here. This bag must be coming on this region, and your stethoscope should be placed in this area of the elbow joint anteriorly, not the back, anteriorly, where we fold the hand. At that place, you have to put little bit on medially inside, not laterally outside, but here medial side. Then this is automatic. Just put the cuff on the arm and put this, press this button. Button is here. Then it will start inflating on its own. It will stop inflating on its own. It starts deflating on its own, and it gives the reading on its own. This is fully automatic. So this is digital or electronic. This is again that pressure dial is there, and you have to pump manually. Okay. So there are 3-4 types of machines are there. You can take, this is the best, this is most reliable. This is most sphygmomanometer. Can you see?
Yes, madam. Yes.
Yes, madam.
एक मिनट, पीछे क्यों जा रहा हूँ? Here the calibrations are there. Here is the pump is there. Then cuff is there. That is also that you have to do it manually. And here you will see the yellow thing. That is the column of mercury. Now Vadekar, तुमचं machine दाखवा. Now this is about the blood pressure. Now here also we have to see what is the capacity of your breathing. So here now you have got very good capacity, Vijayji. So he has got full respiratory capacity. Now this instrument is called spirometer.
Spirometer.
Instrument is called spirometer, especially after cardiac surgery or bypass surgery or any other surgery, to increase the capacity of respiration, because due to surgery the pain is there. So patient can't inflate properly. If patient can't inflate, take the breath properly, then again problem can be there. So he is given exercise to blow. So to start with, due to pain, he will not be able to inflate it or put this ball up. But with the practice, one ball will go. With more practice, second ball will go up. Then third ball will go up. Yes, see, this is first, second, and then with more. Then when all the 3 balls go up, then it is a good respiratory capacity you have got. So this instrument is to measure your respiratory capacity. Okay. Then another other design of the spirometer. It is here. Then third is here. Here, from here you can blow in. Here is the blowing point is there. So you hold it in the mouth. You hold it in the mouth and blow in it. And here the measurements will come. So these are different types of instrument that you must know them. You must be able to use them. थोडंसं थांबायचं का इथं? 2 मिनिटाची सुट्टी घ्यायची?
यस यस यस, चलेगा चलेगा सर,
हाँ.
चलेगा.
2 मिनिटांनी पुन्हा जॉईन
Yes.
व्हा.
2 मिनट के बाद हम लोग फिर से मिलते हैं ब्रेक के बाद.
According to the status of the heart. तो वाल्व खराब होगी तो उसका आवाज अलग से आता है, फिर वो अलग अलग वाल्व होती है, उसमें तो एक्सपर्टसी लगती है. तो हम दैट वी शुड नॉट गो इनटू दोज डिटेल्स.
गुड मैम, थैंक यू, थैंक यू.
नाउ ये स्पायरोमीटर ध्यान में आया, दैट shows your lung capacity, breathing power, expiratory reserve volume, inspiratory reserve volume वगैरह हो गए होंगे आपके. तो that can be measured. Now shall I go ahead?
Yes ma'am.
Yes.
Now due to corona we all are aware of this instrument. We all know what is this. What are these two instruments?
Oxymeter.
Oxymeter. Oxymeter. So it
नाम ही
is just
बहुत
very
मुश्किल है ये.
simple instrument. You don't have, just put the instrument here on this index finger and just see the reading. Keep the button on. So within few seconds you will come to know the blood oxygen level and your pulse rate. Here it is shown. So in corona, this machine previously used by only anesthetic people, anesthetic doctors. But now it is used at home also to see our oxygen level, whether we are good or not. If it comes down below 90, then it is an alarming sign. If it comes about 80, then you must run to the hospital. Now, how the heart auscultation is done is shown in this picture. The chest piece is kept. This is stethoscope. This is stethoscope. This is the ear ends are there that you put them into the ear on the hole of the ear. And this ear end should be in the anterior direction. उल्टा लगा दिया तो सुना नहीं देगा. So they should be in the anterior direction. This is the chest piece. It should be kept on the chest. Here is the area of the heart on the left side. And then you can hear the sounds of the hearts. Then at other place, here at the back, you will see the sounds of respiration. You will hear the sounds of respiration. If it is asthmatic patient, you will see rhals and like a whistling sounds you will hear in the lungs, whistling sound. So during expiration and inspiration, different sounds are there, and then you will come to the diagnosis of asthma also. Now, here is the ECG. ECG means electrocardiogram. ECG is electrocardiogram. Now, here the 5 waves are there, which are given the name P. P is the starting wave. Means when the heart starts contracting. P, Q, R, S, and T. These 5 waves are there. A P is the starting point. So then Q is the start of systole. So the contraction is very strong. So this goes up. That is called R wave. That is the systolic wave. It comes up very fast and goes down fast. So this interval is just fraction of second. Okay, whole beat is 0.8 second, right? So you just see what is the fraction of the this length of this. So systole remains a very just 0.3 seconds or 5 seconds like that. Okay, and this is due to जेवढा वरती जाऊ तेवढा खाली येतो ना. चेंडू जेवढा वरती जाईल तेवढाच तो दणक्यात खाली येतो, फास्ट खाली येतो. So it is the same thing.
Yes,
And then T wave, that is ST segment. This segment is very important from cardiac point of view, that we need not bother. So see, this is the interval, PR interval, QRS complex. This is also called QRS complex, and that indicates the systole, and ST interval. This is whole QT interval. Okay, this is about the ECG. That much is enough for you. Okay, जाऊ पुढे. Can I go ahead?
yes, yes.
Yes, ma'am.
जैसे अभी जेवढं आणि तेवढं बोललं मैम ने, जैसे बोला, तो जितना हम बॉल को जमीन के ऊपर पटकेंगे उतना जैसे ऊपर जाता है, उस तरह से वो हार्ट बीट जो है सिस्टोलिक और डायस्टोलिक का होता है.
This
ऐसा
is the
मैडम
graph. ECG निकालते हैं तो क्या है? तो
Yes.
this is the electric graph, electric recording of the heart activity. इसमें कोई shift हो गया तो some other diagnosis will be there.
yes. पूनम जी.
Something is wrong with the heart. Okay.
मॅडम एक शंका विचारायची होती फक्त. मग या ईसीजी ग्राफ मध्ये PQRS S पर्यंत सिस्टॉलिक असणार आणि ST हे डायस्टॉलिक असणार का?
हो, आणि मग पुन्हा दुसरं सायकल होतं ना पुढे, पुन्हा लगेच दुसरं सायकल सुरू होतं.
होईल. एकदा डायस्टॉलिक झाल्यानंतर परत सिस्टॉलिकच सुरू होईल ना?
हो, डायस्टॉलिक झालं की पुन्हा सिस्टॉल, थोडासा पॉज असतो मध्ये.
ओके, म्हणजे
जस्ट फ्रॅक्शन ऑफ सेकंड पेक्षाही कमी.
ओके, म्हणजे
पॉज झाला की पुन्हा दुसरं सायकल सुरू. व्हॉट इज द हार्ट रेट? व्हॉट इज द हार्ट रेट? यू टेल मी. In normal resting, now you are resting, you are not having any physical activity, and also mentally also you are not under tension. Ki hearing and seeing this, you may come into tension, but need not. So that is the normal heart rate, that is between 70 to 80. 70 we take as a mean. So one beat will take 0.8 second.
one beat.
Second. Now 60 seconds मध्ये 72 बीट होतात. एका मिनिटाला 72 बीट आपण असं धरून चाललं तर एका बीटला किती लागतील? किती वेळ लागेल? किती सेकंद लागतील?
0.8.
Have you calculated?
नाही, आता तुम्ही म्हणाला. सो अकॉर्डिंग टू दॅट म्हणजे अगदी फार कमी वेळात ते होतंय. QRS हा पूर्ण आपला सिस्टॉलिक ग्राफ झाला.
एक बीट होण्यामध्ये एवढे त्याचे म्हणजे इलेक्ट्रिक चार्ज जो आहे तो एवढा कमी जास्त होतो. इलेक्ट्रिक चार्ज, दिस इज द इलेक्ट्रिकल रेकॉर्डिंग ऑफ द हार्टबीट.
मग हे
स्टार्ट होते तेव्हा कसं असतं, नंतर एकदम सडनली कॉन्ट्रॅक्ट होतं तेव्हा काय, पटकन वरती जातं आणि पटकन खाली येतं. आलं लक्षामध्ये? आणि मग पुन्हा ते डायस्टोल मध्ये जातं, रिलॅक्स होतं. रिलॅक्स झालं की पुन्हा सिस्टॉल सुरू होणार, कॉन्ट्रॅक्शन सुरू होणार. 0.8 सेकंदला एक आहे. या सगळ्या भानगडी ज्या आहे ह्या 0.8 सेकंदामध्ये होतात. एवढं सगळं आलं का लक्षात? पूनम
एसटी म्हणजे
म्यूटस, म्यूटस, यू आर म्यूट.
डायस्टॉलिक आहे का?
विनय दरवाजा.
मॅडम म्हणजे PQRST हा
हे
पूर्ण
सगळं 0.8 सेकंदामध्ये होतं. या सगळ्या भानगडी आहेत PQRST हे 0.8 सेकंदामध्ये होतं.
सिस्टॉलिक आणि डायस्टॉलिक इन्क्लुडेड आहे 0.8 सेकंड मध्ये.
हो सगळं.
हा.
आता समजा तुझा पल्स रेट समजा तुझा
माझा
100 झाला तर 0.5 सेकंदामध्येच तुझं सगळं संपेल ना. म्हणजे सिस्टर डायस्टर सगळं. हे इथं आपण 72चा रेट घेतलाय आणि ते समजून हा ग्राफ आपण केलेला आहे. इथं हे सेकंदांचं पण विश्लेषण असतं. तर इथं त्यांनी डिमार्केशन नाही दाखवलंय की एव्हरी हे 5 चौकोन आहेत. आता मी तुम्हाला रिअल रेकॉर्डिंग आहे का बघते. नाहीये. ओके.
हो मॅडम.
आता EEG इलेक्ट्रोएनकेफेलोग्राम. तू आवाज नको करू का. इलेक्ट्रोएनकेफेलोग्राम मी हे ते हेडिंग द्यायचं राहून गेले माझं. इलेक्ट्रोएनकेफेलोग्राम म्हणजे मेंदूचा विद्युत आलेख. मेंदूचा विद्युत आलेख. इलेक्ट्रो एनकेफेलो म्हणजे मेंदू. इलेक्ट्रिक ग्राफ. तर हे ग्राफ या पद्धतीने असतात. ह्याच्यामध्ये अल्फा, बीटा, डेल्टा, थीटा अशा वेव्हज असतात. तर इथं हे किती 16 चॅनेलचं वगैरे असं आमच्याकडे आहे हे इन्स्ट्रुमेंट आणि त्याच्यावरती मी काम करते. तर ह्याच्यावरनं वेगवेगळ्या ह्या ग्राफवरनं मेंदूच्या वेगवेगळ्या अवस्थांचं किंवा त्याच्यामध्ये असलेले काही मेंदूमध्ये बदल झाले असतील. समजा सूज आलेली आहे मेंदूला, गाठ आलेली आहे मेंदूला किंवा एखादा भाग निकामी झाला असेल तर हे अप्रॉक्सिमेटली समजतं. सिटी स्कॅन एवढं क्लिअर मिळत नाही. आता ह्याचं डायग्नोसिस केव्हा महत्वाचं असतं की जेव्हा ज्या माणसाला फिट येते त्या माणसामध्ये हा ग्राफ वेगळ्या पद्धतीनं असतो.
अच्छा.
जितना
वेव ज्यादा रहेगा
आयडिया जी आहे ती सिटी स्कॅन मध्ये जास्त चांगल्या पद्धतीनं समजते. तर आता ह्या ज्या वेव्ज आहेत ह्या अल्फा वेव्ज आहेत. अल्फा वेव्ज म्हणजे सेकंदाला किती वेव्ज येतात. तर सेकंदाला 8 ते 12 वेव्ज झाल्या की त्या अल्फा वेव्ज होतात. आणि ह्या शांत आपण नॉर्मल बसलेलो असू त्यावेळेला त्या वेव्ज येतात. आलं लक्षामध्ये. तर त्या अल्फा वेव्ज असतात मेडिटेशन मध्ये आणखी बऱ्याच वेळेला आपण थीटा वेव्ह कडेही जाऊ शकतो. कारण इलेक्ट्रिक ऍक्टिव्हिटी आहे ती ब्रेनची कमी होऊन जाते. नंतर झोपलेलो असू त्यावेळेला आणखी ऍक्टिव्हिटी कमी होते. मग वेव्ज आणखी कमी येतात. त्यांना थीटा वेव्स म्हणतात. काही वेळेला डेल्टा पर्यंत पण जातो. आता ह्या थीटा वेव्स असतात ह्या एका सेकंदाला 5 ते 8 एवढ्या असतात. 5 ते 8 एवढे असतात. एक मिनिट मी तुम्हाला ही जरा फिगर मोठी करून दाखवते.
थोडस हिंदी मध्ये समजावून सांगा.
हाँ हिंदी मध्ये. तो ये वेव्स होती है. अभी इसमें देखो ये बहुत सारी डेल्टा वेव्स है. अभी ये सेकंड जो है ना यहाँ एक डार्क लाइन है और यहाँ एक डार्क लाइन है, बोल्ड लाइन है. तो ये जो डिस्टेंस है वो 1 सेकंड में क्रॉस होता है. ऐसा उसका स्पीड होता है. तो इसमें ये डेल्टा वेव्स बहुत ज्यादा है. तो कुछ तो उसको पेशेंट को एक तो उसकी जागृत अवस्था कैसी है, पूर्ण जागृत है या उसके दिमाग में सूजन वगैरह है, एक बहुत यानी क्लिनिकल पिक्चर देख के ही इसका डायग्नोसिस करना पड़ता है. और जो एक्सपर्ट है रीडिंग में वही कर सकता है. उसको क्लिनिकल पिक्चर जो है वो भी ध्यान में देना पड़ता है. तो ऐसी ये वेव्स होती है. और ये से 1 सेकंड में अभी ऊपर से क्या गिनती करो नहीं तो नीचे से गिनती करो, ऐसा होता है. तो 1 2 3 4 ऐसी गिनती करते जाओ. और वो तभी क्या देखते ही पिक्चर समझ जाता है कि स्लो वेव है या
फास्ट वेव.
फास्ट लेवल जो होती है वो हम विचार वगैरह ज्यादा करते हैं. और फ्रंटल रीजन जो हमारा होता है वहाँ फास्ट वेव्स होती है।
सुपर
तो एंटीरियर पार्ट जो होता है ब्रेन का यानी फ्रंटल लोब जो होता है वहाँ ज्यादा बीटा वेव्स होती है। आया ध्यान में?
यस मैम फैंटास्टिक या विल मूव फॉरवर्ड।
ये अभी जीएसआर जो होता है गैल्वानिक स्किन रिस्पॉन्स, जीएसआर जिसको बोलते हैं, तो उसमें ये इंस्ट्रूमेंट ऐसा होता है, फिंगर पे लगा देते हैं, वो यहाँ फिंगर पे लगा देते हैं, 2 फिंगर में लगा देते हैं। इलेक्ट्रोड जो होते हैं वो फिंगर में लगाते हैं, ऐसे 2 नजदीक के नहीं, 2 फिंगर, ये भी चल सकता है। तो 2 फिंगर पे लगाते हैं और उसकी जैसी साइकोलॉजिकल सेटअप होगा, मानसिक अवस्था जैसी होगी, उसके मुताबिक स्किन में भी चेंजेस आते हैं, स्किन में भी चेंजेस आते हैं। तो स्वेटिंग होता है, इलेक्ट्रिक चार्ज, जो एवरी सेल हैज गॉट इलेक्ट्रिक चार्ज, एक भी सेल ऐसी नहीं है कि उसको इलेक्ट्रिक चार्ज नहीं है। तो मानसिक स्थिति जैसी हो वैसा ये इलेक्ट्रिक चार्ज जो है स्किन का वो भी बदलता रहता है, और उसका ये ग्राफ है, इसका ये ग्राफ है, और ये उसका मशीन है, ये मशीन है गैल्वानिक स्किन रिस्पॉन्स, GSR, गैल्वानिक स्किन रिस्पॉन्स। तो ये मशीन होता है, वो भी फिंगर पे लगा के उसका साइकोलॉजिकल रीडिंग हो सकता है, उसका सायकोलॉजिकल स्टेटस कैसा है वो देखा जाता है। कितीपर्यंत घ्यायचं मला सांगा तुम्ही?
ऍक्च्युली आता किती 5 सेल स्लाइड राहिलेत ना? किती 5 स्लाइड राहिलेत ना?
1 मिनिट.
नाही 5 स्लाइड राहिलेत असं म्हटलं मी. 5 स्लाइड राहिलेले आहेत ना?
हा बघूया ना आता.
हा
आता पुढची जी स्लाइड आहे दॅट इज दी नॉर्मल रेंज ऑफ ब्लड प्रेशर. नॉर्मल रेंज आणि हायपरटेन्शन कशाला म्हटलं जातं त्याचा हा चार्ट आहे. तर नॉर्मल should be less than 120, but as the age increases it rises, but it is normal. उम्र के हिसाब से जैसी उम्र बढ़ती जाती है थोड़ा नॉर्मल ब्लड प्रेशर है वो भी बढ़ते जाता है. तो 140 150 तक जितनी उम्र है 100 में जितनी उम्र है उतनी मिला दो. सपोज 50 है कोई तो 100 plus 50 150 blood pressure is normal for that age. तो भी हम बोलते हैं कि 130 के ऊपर जाना नहीं चाहिए ना. तो नॉर्मल जो प्रेशर है लेस देन 120 एंड लेस देन 80. प्री हाइपरटेंशन जो है 120 to 139 और डायस्टोलिक प्रेशर है वो 80 to 90 के ऊपर जाना नहीं चाहिए. हाइपरटेंशन कब बोला जाता है 140 to 160 हाइपरटेंशन है और डायस्टोलिक जो है 90 to 100. हाई ब्लड प्रेशर स्टेज 2, दिस इज स्टेज 1, स्टेज 2 160 और हायर और 100 के ऊपर डायस्टोलिक हो गया तो इट इज अलार्मिंग. और हाइपरटेंसिव क्राइसिस जब होता है higher than 180, higher than 110, then it is emergency. You must contact the doctor. You should go to the doctor for further assessment and treatment. Okay. अभी this is the respiration graph. रेस्पिरेशन ग्राफ. तो रेस्टिंग पीरियड में अभी आप रेस्ट कर कोई फिजिकल एक्टिविटी नहीं है तो दिस इज द रेस्टिंग रेस्पिरेशन. मीन्स हाउ मेनी ब्रीथ्स आर देयर, अबाउट 15 10 एंड 15 के बीच में है तो 11 12 13 14 ऐसा अपना ब्रेथ होना चाहिए व्हाइल रेस्टिंग. जॉगिंग कुछ फिजिकल एक्टिविटी है तो अप टू 20-25 तक ठीक है. ओके. और जॉगिंग, ज्यादा फिजिकल एक्टिविटी कर रहे हैं, जॉगिंग कर रहे हैं, या तुम्हारा वो बोर्ड होता है जिम में, उसके ऊपर ज्यादा दौड़ कर रहे हैं, तो इट शुड it comes to about 30 or so, depends on how much activity you are doing. So this is the normal range with the activity. Okay. Now here is, this graph is very important. Types of breathing. Can you see the graph? This is normal pattern of respiration. This is normal pattern of respiration. So these inspiration and expiration are almost same. Inspiration and expiration are almost same. Then in asthma or COPD, means chronic obstructive pulmonary disease, इसमें क्या होता है, एक्सपीरेशन जो होता है अस्थमा में वो लॉन्गर होता है, सांस छोड़ने में ज्यादा तकलीफ रहती है. सी, दिस इज इंस्पिरेशन, दिस इज एक्सपिरेशन. लॉन्ग एक्सपिरेशन इज देयर, लॉन्ग एक्सहेलेशन इज देयर, बट इनहेलेशन इज शॉर्ट. तो देखते हैं ना आप, अस्थमा वाले होते हैं तो हाउ दे टेक दी, दे फिक्स देयर शोल्डर्स एंड देन inhalation is short but exhalation is longer. Then when respiratory rate is less, then the long pause is there. Between two breaths, there is always a pause. Normal, it is normal. A short while, momentary pause is there. Here, the pause is long. See, this is the pause. This is inspiration. This is exhalation. This is pause. Pause is longer. So this is called bradypnea. Brady means slow. Apnea means respiration. So this is bradypnea. This is called bradypnea. So respiration comes down, 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 down. So it is seen in terminally ill patients. Then fast and deep respiration. ये जो ब्रैडिप्निया होता है, ड्रग इंड्यूस्ड रेस्पिरेटरी डिप्रेशन, डायबिटिक कोमा, इंक्रीज्ड आईसीपी. देन ये फास्ट एंड डीप ब्रीदिंग किसमें होता है, तो मेटाबॉलिक एसिडोसिस. मेटाबॉलिक एसिडोसिस मीन्स हम ज्यादा भाग दौड़ करते हैं तब मेटाबॉलिक एसिडोसिस होता है. जब एसिड सब निकल जाता है, देन इट कम्स टू दी नॉर्मल. सो डीप एंड फास्ट. एक्सरसाइज के बाद भी होता है. एंजाइटी भी होती है तो रेस्पिरेशन ये होता है. देन अटैक्सिक इरेगुलर विथ लॉन्ग एपनिक पीरियड. इरेगुलर होता है और बीच में इनहेलेशन भी नहीं, एक्सहेलेशन भी नहीं, ऐसी अवस्था हो जाती है. तो ये पॉज है. ये थोड़ा 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 बढ़ते जाता है, फिर लॉन्ग पॉज आता है, फिर से डीप ब्रीथ, और फिर से कम होते होते ये हो जाता है, पॉज आ जाता है. तो ड्रग इंड्यूस्ड रेस्पिरेटरी डिप्रेशन होता है, इंक्रीज आईसीपी, इंट्राक्रैनियल प्रेशर, ब्रेन डैमेज स्पेशली इन दी मेडुलरी डिसीजेस. देन दिस इज चेन स्टोक्स ब्रीथिंग. चेन स्टोक होता है, जल्दी जल्दी होता है, फिर पॉज आता है, फिर से छोटा होते होते फिर बड़ा हो जाता है. ये क्या बोलते हैं, चेन स्टोक ब्रीदिंग. तो इसमें ड्रग इंड्यूस्ड रेस्पिरेटरी डिप्रेशन, ड्रग कोई भी लेते हैं तो कोई भी यानी जो हमारे ब्रेन को डिप्रेस करता है वो सब ड्रग से ये ऐसा टाइप ऑफ ब्रीदिंग आता है. एंड एप्न्यूस्टिक प्रोलॉन्ग इंस्पिरेटरी पॉज, बहुत देर तक यानी सांस लेके बैठ जाता है, देन पॉज आता है, देन इट स्टार्ट्स एक्सहेलिंग. तो पोंटाइन लीजन, पोंटाइन यानी पॉन्स करके ब्रेन में, ब्रेन का पार्ट होता है, तो वहां कुछ इंजुरी वगैरह हो गई तो इस टाइप का रेस्पिरेशन होता है. कभी हम प्राणायाम जो करते हैं तो हमारा एक्सहेलेशन, इनहेलेशन और कुंभक और पॉज, उसके ऊपर वो कैसे हम पे परिणाम करता है वो देखते हैं. इनहेलेशन, होल्ड ऑन, एक्सहेल, होल्ड आउट एंड इफेक्ट. तो इनहेलेशन और एक्सहेलेशन सेम मात्रा में है तो ये बैलेंसिंग होता है. 8-8-8-1-8-1 तो वो भी बैलेंसिंग होता है. 6-2-6-2 ये भी बैलेंसिंग होता है. बाद में एक्सहेलेशन की हम जब मात्रा बढ़ाते हैं, एक्सहेलेशन वी इंक्रीज 4:6 हो गया तो इट इज ए कामिंग. Exhalation has always got the calming effect. Longer the exhalation, better the calming effect, tranquilizing effect. So 4-8-4 calming, 6-1-8-4 calming, 6-1-10. देखो अभी जैसे जैसे एक्सहेलेशन इंक्रीज होता है वैसे वैसे कामिंग इफेक्ट ज्यादा आता है. और एक्सहेलेशन कम किया, इनहेलेशन यानी इनहेलेशन से एक्सहेलेशन कम किया तो दैट इज एनर्जाइजिंग इफेक्ट. 4-4 एनर्जाइजिंग, 6-4-6 एनर्जाइजिंग, 6-6-6 एनर्जाइजिंग. ओके, यू अंडरस्टूड दिस ग्राफ. सो इसलिए एक्सहेलेशन should be always longer, and if it is longer, better the calming of the mind, better the concentration, better the understanding, better the awareness. Awareness is also better with the long inhalation because exhalation is always a relaxing procedure, relaxing of the muscles, and at that time you are controlling it, means your mind needs to be applied on this activity, and that's why the focusing, concentrating power increases, awareness increases, because mind is not anywhere, mind is only on exhalation. From yoga point of view, this figure is very important. You must have been seen this figure while learning the respiratory system, its all volume and all. Now this is the graph of deep breathing. Now this is the normal breathing. Okay, this is normal. Means tidal volume is 500 and so. And in deep breathing, this is the pattern. This is now here is the longer exhalation is there. Here the longer exhalation is there. This is the deep breathing. Now here. Now we will see first the normal breathing. Now this is the lung capacity here from 0 to 6,000 ml. That is our lung capacity. Okay. Now this is the time period. This is the time period. Okay. Now this is the tidal volume. Tidal volume. This is the about 500 cc is our tidal volume. All of you know, I think. In normal breathing, how much air we take? 500 cc we take and 500 cc we exhale out. Okay.
ml, madam.
So that
ml.
is the tidal volume. Okay.
ml, not cc.
It
Sorry.
is same. cc and ml is same. Cubic
Okay,
centimeter and milliliter. That is same.
Yes, cubic capacity and ml is same.
Okay, you can call it ml also. It is cc is also correct. ml is also correct. Okay. It is same. Now, deep breathing. Now, how much you can go up to 6,000? If you have a deep breathing, so our lung has got certain limitation, certain capacity, and that is about 6,000 cc or 6 liters. 6 liters. So maximum how much you can go up to the 6,000, and how much you can exhale up to here. Now, here, now this is the line here, it matches. So some air remains in the lungs. You can't exhale out zero. You can't exhale out zero. Some air remains in the lung, and this is the residual volume. After deep breathing and deep expiration, there remains some air in the lung, and that is about 1200 cc. It is about, this is 1000, so it is more than that. So about 1200 cc is the residual volume. That air remains in the lungs, that cannot be exhaled out. Okay.
True.
Now again, this is normal. Now maximum expiration, that is inspiratory. This is inspiratory reserve volume. This is expiratory reserve volume. After normal expiration, how much you can more exhale? So this is up to here. So how much it comes? It is about 1000, 1500 or like that. It comes expiratory reserve volume. This lower spike. So after normal expiration, again you are asked to, again you more. So you will come to this level. So this is expiratory reserve volume, this. Okay. This is inspiratory reserve volume, means after normal inspiration, you are again told that you take more. This is the limit. Then total expiration and inspiration, a forced inspiration, forced expiration, that is called vital capacity. Maximum expiration, maximum inspiration is called vital capacity. Then from here to here, inspiratory capacity. This is functional residual volume. And this whole thing from 0 to here, it is 6,000 cc. That is total lung capacity. Suppose you have removed the lung in inspiration, and if you dip into the water and squeeze it, you will get 6,000 cc of air from that lung. That is the lung capacity. In pranayam, we increase with the forced inspiration. We increase the capacity of the lung. So more and more alveoli, they open up. ये वायुकोश होते हैं ना, वो ज्यादा ओपन अप होते हैं, उनकी टेंसाइल स्ट्रेंथ भी थोड़ी बढ़ जाती है. They open up and fill up fully. So you can have the, with the pranayam, the lung capacity will increase to 5 to 6,000 cc or 5 to 6 liters. Yeah, this figure is very important. This figure is very important. And they can ask the question regarding this, different types of volumes. Last these slides. Many times patients come to you for yoga, for their problems, and they must have gone to the doctor. The doctor must have done some basic investigations, and that we must know what is the reading now and what is the normal reading. So I am showing you few reports here. So what we have to see. Now this type of report is there. Okay. Now HGB, HB. So hemoglobin level in the blood. Normal, this is the basic investigation. This is very much basic investigation.
Yes.
So what is the HB? So here is the whatever reading is there and what is the normal range. Here they have written the normal range. So you will come to know what is the normal range. Mostly they write the normal range. So you need not bother whether it is less or then you have to compare with this normal value, normal range. Then RBC. RBC means red blood cells. So these are now here 4.07 per cubic cmm milliliter. Micro. WBC count 7.9 is here per cubic. Cubic means no, all of you cubic. Cubic म्हणजे माहिती आहे ना सगळ्यांना. What is the meaning of cubic? What is the cube?
अरे हो नाही सांगा ना. येस और नो काय एवढं काय.
Yes, ma'am.
Who will explain what
It's
is
a
the
cube,
meaning
it's a
of
cubic.
cubic?
हा प्लीज रितू एक्सप्लेन इट.
Just a minute, I am coming.
Yes.
Measure of volume.
3 dimensions are there. 1, 2, and 3. So this is called, so 1 mm. So you have to read it in like this, cubic milliliter. तो इतना सा ब्लड लिया तो उसमें कितनी रेड ब्लड सेल होगी, व्हाइट ब्लड सेल होगी, इसका मेजरमेंट देखना पड़ेगा आपको. तो आरबीसी नॉर्मल इज 4 to 9, WBC 4 to 8, platelets 2 to 4 lakhs, same per volume. These volumes, these readings you need not bother. These 4 are very important. Then differential count type, because WBC are how many types? What are the types of WBC, white blood cells? Do you know?
Leukocyte, erythrocyte.
Granulocyte, lymphocytes, monocytes, and eosinophils. Now, granulocytes, what is the normal range? Here they have given, here normal range and here. So that range, within that range means okay. But when the granulocyte increase much more, then it indicates some active infection in the body. Corona ho gaya, some other infection is there, pneumonitis is there, bronchitis is there, urinary infection is there, then this count will rise up. Then lymphocytes, they increase in the chronic infection, chronic illness, like tuberculosis or cancer or other diseases. So this lymphocytic count increases in chronic illnesses, not the acute. In acute illness, mostly granulocyte, they increase. And eosinophils, EO. So they increase in some allergic conditions. Allergic conditions. Hay fever or some allergy you have come across. So it increases in those conditions. So you have to compare with the normal range. Now other blood examinations. Now what should be the blood sugar? Fasting blood sugar. Now here the result is written. Here you have to see the normal range. 70 to 110 is the normal range. If here it is increased 187, means it is definitely very, very high. Now fasting urine sugar is present plus. It may be then 2 plus according to the color, yellow color, green color and brick red color. So these are the levels. Here it is 1 plus, 2 plus more sugar, 3 plus still more sugar. Then PP means postprandial, 2 hours after your meal. PP means postprandial, 2 hours after meal. What is the normal range? 70 to 140 is the normal range. Here it is 234, means diabetes is there. Now here post-diabetic urine is checked, which is 2 plus. Now blood urea. Urea is the substance produced in the body in nitrogen metabolism. So that indicates the renal function. That indicates that level increases, indicates renal function or kidney function. So this is here it is 25. So normal range is 16 to 45. If it is more than 45, then some renal problem is there. Then blood urea nitrogen. Okay. So nitrogen kitna hai? Ye. So it is 7 to 21. Serum creatinine. So it is intrinsic source of nitrogen. Normal range is 0.6 to 1.5. If it is more than that, some serious problem with the kidney is there. Serum uric acid. Gout we call that, gives rise to joint pain and swelling of the joint is there. That is 2.6 to 7.2 is the normal range. Then serum calcium. Now there is a very much trend that serum calcium and vitamin D, they become less. Then you get various problems. So 8.4 to 10.4. Then serum cholesterol. Cholesterol also, level of cholesterol is indicator of our cardiac status. If it is high, then problem is there. 160 here, 140 to 250 is the normal range. Then HDL, LDL, low density cholesterol, high density cholesterol or lipid, they also indicate your heart status. So these are the things for the today.